On March 13th, 2020, a 27-year-old woman who had come home from the U.S. was confirmed as the first person to test positive for COVID-19 in the country. As she was admitted into hospitalized care, we began contact tracing to identify the people she had been in contact with. Today marks 100 days since that first case, and it has indeed been a journey, one which has familiarized us with such terms as contact tracing, quarantine, community spread, social distancing, and such words that we were not used to before. At a personal level, when we announced our first COVID-19 case, I'd only been in office for 2 weeks. And when I walked out of the State House following my confirmation as Cabinet Secretary of Health, like a majority of us, I admittedly knew very little or nothing about coronavirus. How quickly that changes. I wish to thank His Excellency the President for the confidence placed in me and a myriad of people who he has honored to work in this steep journey. Indeed, were it not for our healthcare workers, the leadership at the Ministry of Health, the National Emergency Response Committee on Coronavirus, the Command Center, and the interministerial teams who put in and continue to put in endless hours to ensure the safety of all Kenyans, our situation would have been dire. I would wish to take a special thank you to the Fourth Estate, you members of the media, for the unwavering support you have given us in those 100 days when it comes to highlighting all matters related to COVID-19, for giving us your airtime, for helping us in spreading the truth on behalf of NAC and the Health Ministry, and indeed all Kenyans. And on my own behalf, I would like to say thank you. We are greatly indebted to you. Last but not least, I would also like to thank my fellow Kenyans who, by and large, have heeded instructions, stayed at home, social distance, worn masks, and kept our nation fairly safe. But where are we now, fellow Kenyans? We have come a long way since our first patient was confirmed. To begin with, they threw a spanner at the perception that COVID-19 was a disease of the elderly and brought to light the fact that it would affect anyone, including the young, who represent a significant percentage of our national population. They also illuminated the fact that as a country, one that had only 8 infectious disease beds, we were ill-prepared to deal with a epidemic such as COVID-19. In 100 days, and with the disease now affecting 40 out of our 47 counties, including refugee camps, our bearings are clear and direction determined, because indeed, as I paraphrased at the beginning of this journey, mtakacha mvunguni sharti ainame. We have put in the work and will continue to do so, taking note of and learning from challenges and failures we have experienced since this journey began. It is noteworthy that when COVID-19 struck, Kenya had never had a situation that required the mass quarantining of individuals, and we therefore did not have a framework for it, the experience on how to deal with it, and regulations on whose responsibility lies where. We also did not have the reagents and testing kits that are an essential part of managing the epidemic, and along the rest of the world had to begin the competitive process of procuring them, together with PPEs that are critical for the protection of our warriors. Between this and the capacity shortages in human resources, medical equipment, physical infrastructure, preparedness seemed an undaunting task. We had to adapt and learn quickly, largely through trial tribulations, and innovation that particularly impacted our quarantine system. We are aware that we inconvenienced many of you in the process, and for that, I would like to offer my apology with assurance that our systems are now much better and practical. We are still learning. That we are in the midst of a crisis and going through a battle is something we now understand very well. COVID-19 has badly weakened our economy, cost us jobs, and impacted our business, particularly those in the informal sector. But we are forging on and continuing to balance economic concerns with the preservation of lives. Thanks to President Uhuru Kenyatta and the measures he has taken and directed, we are recovering and we will continue to do so. We started with an 8-bed infectious disease capacity, developed a 120-bed capacity at Bagathi, quickly converted over 500 beds at the Kenyatta University National Hospital for COVID-19. We cascaded capacity to the county levels where COVID-19 has effectively triggered the transformation of the healthcare system in the country and underscored the importance of coordination between the national and county governments. There are many commendable examples of counties that have committed themselves to the rapid building of capacity. We congratulate them and remain confident that in the next 2 weeks, all counties will have at least 300 isolation beds as directed by President Kenyatta. Let us not forget that healthcare is a devolved function and that national assistance notwithstanding, every county is tasked with preparing to provide the necessary services. We have provided guidelines for safe service provision, including establishing that appropriate PPEs are available in all health facilities and to all community health volunteers, and that all health workers understand safety protocols. At the same time, we have built capacity and self-sufficiency in manufacturing of PPEs as part of our COVID-19 response. We have factories now producing PPEs in Kenya, and our capacity to manufacture and supply hand sanitizers has surprised many. Fellow Kenyans, I'm sure that you have also noticed the significant increase in testing capacity. We have pursued and continue to do so numerous channels to ensure that the coming weeks the capacity is bolstered even more. Just to highlight how we have progressed month on month and where we are today. In March, from the date that we announced, we did 3,419 samples were tested, out of which 78 were positive. In the month of April, 19,108 samples were tested, 328 testing positive. In May, 57,527 samples were tested, resulting to 1,615 positive cases. As at June 21st, 59,958 samples have been tested, with 2,717 testing positive. These figures demonstrate that the number of samples tested increased as we upgraded our testing capacity. Following recent financial allocation from the national government, and as a result of additional funding we have received from development partners, local well-wishers, we now have greater capacity to combat COVID-19 by enhancing not just our testing capacity, but also our distribution of free masks to the vulnerable communities and tracing mechanisms at cross-county and national border levels.